Good afternoon, everyone. Certainly delighted to be here this afternoon. I'm Dr. Tim O'Shea, and this is my lovely assistant, Elyse. Say hello to the people.
Hello.
And today we're going to talk about dental hygiene a little bit. I was really impressed by a story Elyse told me recently about a classmate of hers. She's in 6th grade, a kid who's only 11 years old and lives a normal life, has a normal kid diet, and went to the dentist and had to have 4 cavities filled, and one of them was below the gum line. So this was already much too young for this kind of decay to be happening. So you may have seen my 2 chapters recently, New Agendas in American Dentistry and Newer Agendas in American Dentistry. So if you haven't seen those chapters, you might look at them. But something that I've come to realize lately in the last year or so is that dentists generally are too busy. They're too busy to teach people really how to clean their teeth. And at this age, it doesn't seem so important. They don't think it's important because their lives are so busy, they're so indestructible, and they have such a long life ahead of them. But unfortunately, that's not quite accurate if a child of 11 years old is already having 4 cavities every 6 months or a year. That is ridiculous. So that's Caprice over there, and she's snoring. Shut up! Stop snoring, Pupper. At least anytime Caprice snores, you can just like whack her, okay?
No.
It's come to my attention that I really don't think, except for a very desultory, rushed demonstration, that dentists or dental hygienists really don't have time to teach people, whether they're kids or adults, how to really clean their teeth properly. Ordinary kids and ordinary people, they really don't understand the anatomy of the mouth. They really don't understand the anatomy of the teeth. And so that's what we're going to talk about a little bit today. Now I'm going to get some close-ups of this, but this is a model of the teeth right here. Now can you see that, Elyse? Have you ever seen this before?
No.
Did any dentist ever grab a model like this and explain things to you before?
No.
Okay, so here, this is actually a model of the adult mouth. This is not a course on naming the teeth or anything like that. We're just going to, I want to just show the arrangement of the teeth, how the teeth are locked into place, and the structures that hold them there. Now, Elyse, you're 11. Do you have most of your adult teeth by now?
Not really.
You're still going to lose a few more, did they
Yes.
say? Okay. And you have braces as well, right?
They never said.
They never said?
They never said.
Never said what?
What teeth are adult teeth and what teeth I'm going to lose, what are growing in.
But you think you still have a few more that are going to come
Yes.
out? Okay, that's fine. Well, first of all, we have 2 models here. We have the model of the teeth, and we see the upper teeth and the lower teeth. And we see, look at this, Elyse. We see the back teeth are the molars, right? And the front teeth are the incisors. And then we have the premolars and the canine teeth. Okay, so those are sort of the names of them. They are locked into place into like sockets. They are like sockets, almost like a light bulb socket. And in the socket, they are surrounded by your gums. Now in this particular model, the gums are clear. You see how the gums are clear so that you can see through to the root of the tooth. You see all the way through to the root of the tooth so that you can see how deeply the roots of the teeth are implanted in the bone. Now let's look at another picture here, okay? Now this is just one single tooth. Now I'm going to be showing close-ups of this, so don't worry. This is just one single tooth, and it shows how this is like we're looking from the back of their head. We're looking at their molar that's the farthest back. We're looking from the back of their head, right? As though we could see this. And the tooth is in this socket here. See, the tooth is in this socket. And here's the bone. Now in the lower jaw, this is actually your jawbone. Now take your hand and feel along the side of your jaw. You feel that? No, your actual hand. Yeah. Now, do you feel that jawbone? Go like this, Elyse, from the ear all the way to the chin. You feel that bone? That's your jawbone, and that's what the teeth are really locked into. Okay, now, in between the bone and the teeth are the gums. Now, lift up your lip, Elyse, and check out your gum, and they're pink, right? Okay, so now the gums line not only the outside of the teeth, but they also line the sockets where the teeth are in. So you see how the pink goes up here and then it comes down and it surrounds both roots. You see that? And then it comes back up here, and then it's the gums on the inside of your mouth. You see that? Take your finger, Elyse, and put your finger, feel the inside gum. Feel the gum on the inside of your teeth. People never think about that one, but that's part of the gum too. So here's the thing that they never teach you. They never teach you that the gums have to be taken care of as well as the teeth, because gums can deteriorate as the teeth decay. If you don't clean your teeth really well all the time, the gums will recede when you get older, and then the teeth will get loose, and eventually they may decay. And then dentists like to do a procedure now called an implant. Now, your uncle is a very successful dentist in what city?
Las Vegas.
Yeah. And have you ever been to his office before?
Many times.
And is it big or little?
It is big.
It is big, okay. Again.
It's much bigger compared to a lot of dentists.
Okay, so he has a very big practice in Vegas, right? Okay, so now, did you ever notice that when they tell you how to brush your teeth, they're kind of like in a hurry?
Yeah.
And how long would you say it took the last time you were there for the hygienist to explain to you how to brush your teeth?
No, 0 minutes there.
You mean you didn't even explain it at all? Because they're too busy, right? Is that right?
Yes.
Because why? Because
they're busy.
they're too busy to tell you. I know, it's like that all over the place. Other structures that hold the roots of the teeth into place are the cementum and the periodontal ligaments. And then, Elyse, do you see this dark red space in the very center of the root here? That is the root of the tooth, and that is actually a sensitive nerve. The problem is, what happens if you eat too much candy or something and you get like a hole in your tooth, which is what a cavity is, right? And it decays this enamel here, the white part, and eats its way all the way into the nerve. What happens then? What happens then is you begin to feel
pain.
And have you ever felt pain from a cavity?
No.
Okay, that's very good, because you go to the dentist very regularly, every 6 months. So for you, since you're so young, the holes never got that deep that they're actually getting to the root. But sometimes, I'm telling you, here's what, in my experience, what most people do, especially adults, a lot of adults, they don't go to the dentist every 6 months. In fact, I did that most of my adult life because I was stupid and I was like too busy, right? And so what happens is, when do you think the adults will go to the dentist? If the adults are too lazy to be on a regular program of dental hygiene where they go in every 6 or 8 months or something like that, if they just give up on that and say, oh, I'm too busy, I can't be bothered, when do they wait to actually go into the dentist, do you think, most of them?
Never.
No. Eventually they show up at the dentist because...
When they have tooth pains?
Right, when they have a toothache and it hurts really bad. And then do they want to wait around a couple weeks? Now suddenly, this adult who's been putting off his dental hygiene, right, suddenly gets a toothache, or he drinks something cold and he notices, whoa, that really hurts. And then it starts keeping him awake at night, and then he calls the dentist. Does that guy want to wait for a couple weeks before he gets an appointment to take care of it?
No.
When does he want to go in?
Right at that moment.
Right now. Exactly. But something happens for a lot of people who really put their dental hygiene off for too long. Or the worst thing is, Elyse, and this I know because this happened to me because I'm a moron, because I didn't do this right. The worst thing is a lot of adults, they will have a toothache pretty bad, and then it will go away for a couple weeks. You know what I mean? They'll think, oh, that was nothing. I don't have to worry about that. And then the toothache will come back again and be really bad. And then it'll go away for a couple weeks and it'll keep coming and going. You know what I mean? They say, I'm too busy, so they put it off and they don't go in. Now, when that happens, the inflammation of the nerve root in the tooth might develop into an inflammation becomes an infection.
Yes.
Yeah. Now, when it becomes an infection, that infection can travel all the way down to the bottom of the nerve root, and that hurts really bad. That hurts a lot. At that point, the dentist may want to do what's called a root canal, in which he drills out the entire nerve root. He cleans it out. Well, he destroys the nerve root. He destroys the nerve, and then he packs that in with some material and seals up that nerve root for good. After they're finished filling up the root canal, then they'll put a crown on the tooth, so it's pretty expensive. But the other group of dentists today, they have a new philosophy, and this is the philosophy of implants. Now, do you know what an implant is, Elyse? Because your uncle does tons of them in Vegas.
To completely remove the tooth and replace it with a fake one.
Excellent! That's exactly right. So they can pop the tooth out in 30 seconds. Poof! Your tooth is gone. And then they take, actually Kevin just had one of these, your stepfather just had one of these. They take what's called a post, which has threads in the bottom, and they screw it into the bone, because now you have a socket there. They screw it into the bottom of the socket. They wait 4 months, hoping that new bone will make it solid in there, and then they screw on a top part, and then they put a nice crown on the top of all of that, and that's called a dental implant. Now, that's really expensive. It's very expensive, but insurance covers it like that, and that's why a lot of dentists like to do it. Most people, especially kids, they'll just brush the top of the teeth. They'll do it really fast because they want to watch their TV show or get back online and watch their, what are you watching online these days?
YouTube.
Yeah, you want to get back to YouTube as fast as possible. So if they'll put some toothpaste on there, they'll just go, and then if they're lucky, they'll go like this, but maybe not. And they don't do anything here or here. Have you ever noticed that when you're in a hurry? Because who cares, right? Okay, now this is ridiculous because after all these years, I just recently discovered this. I'm more stupid than anybody who's listening to this, I will admit it. The most important thing to do when you're brushing your teeth is that the particles of the sugary foods that you're eating or the trashy foods that you're eating, like for example Cheetos, potato chips. What's your favorite type of candy bar, Elyse?
I don't know, Twix.
Twix. Name 2 other candy bars that kids eat a lot, your friends, that are especially chewy.
I don't know, Milky Way.
Milky Way and?
Three Musketeers.
And Three Musketeers, perfect. Because those are really gooey and sticky, right? And that stuff, they stick in your teeth. Now, not only does that get caught in between the teeth, but now remember how your gums are pink, like in this picture? Well, in this model, the gums are clear, so we can see through to the roots of the teeth. But here's the critical area where pieces of Milky Way and Snickers, Twix, get caught. They get stuck right in the groove right in the connection between the gum and the tooth. They get stuck right in the connection between the gum and the tooth. I think I told you this before, see if you remember this. The majority of tooth decay occurs within how many minutes of eating?
10.
Excellent, that's true. The majority of tooth decay occurs within 10 minutes of eating. So even if you can't brush your teeth after every meal, especially if you eat a candy bar or something horrible, at least, rinse your mouth out with water and swish it all around. Okay, so now we're going to talk about brushing our teeth. Now, Elyse, how many times a day do you brush your teeth?
2.
And when are they?
In the morning and before I go to bed.
Well, that's good. That's good. Okay. There's a lot of opinions on this, but I'll tell you the truth. Get a soft brush. Get a soft brush. And because we want to massage the gums. When we're using a toothbrush, the most important areas are not the top of the teeth, the top surface. It's in between the gum and the tooth. That's where, and remember your friend just had that filling, 11 years old, and they had that filling that was under the gum, and they came out and asked the parent if it was okay if they would cut part of the gum away so they can get to the cavity. Remember that? Remember that kid told us that. That is ridiculous when you're 11 years old, because guess what? When you cut gums away, gums don't repair. And so that's something that you see in older people who haven't taken care of their teeth for years and years. The gums recede, and if the gums recede, the teeth get looser. So, back to brushing your teeth, the most important location for cleaning is the space between the teeth and the gums. So, this is the motion. And this is a lot of work where you go like this. You see what I'm doing? Okay, you do that. Slower. Yeah. Okay, that's excellent. Now, the minimum to do, the absolute minimum, is 10 strokes per tooth. So it's like 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. Next tooth, 1, 2, and so there'll be some overlap, but that's okay. Then after you do that, to one whole quadrant, do you know what a quadrant is? 1/4 of the entire mouth. Then you can go back and go like this, Elyse. You can go back and gently massage the gums and make sure that you get all that debris out of there. Because there's two things that can go wrong. If you leave those Snickers and those Milky Way pieces in there, not only will it do what it did to that kid, get locked between the gum and the tooth and cause a subgingival cavity, a cavity below the gum, it will also inflame the gum, and it can cause an infection in the gum and damage the gum, and the gum can start receding. Okay, so we just showed how to brush 1/4 of the mouth, right?
Yes.
But that was only the outside. The bad news is, ready? You have to do the same thing to the
Backside.
to the back side of all. So 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6. See what I'm doing? Okay, let's see you do the back side of that. Now count loud.
1, 2, 3, 4, 5, 6,
No,
7, 8,
Elyse,
9, 10.
You're just brushing up. Try to rotate it.
1,
There
2,
it is.
3,
Rotate.
4,
That's
5,
it.
6, 7, 8, 9, 10. 1, 2, 3, 4, 5, 6,
Louder.
7, 8, 9, 10. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10.
That's good. Now here's the hard part. Getting to this area, because you gotta move your hand all around. Okay, now it's the same thing. After you get done doing that, then you can gently massage the gums this way. Okay, why are we doing that? Why are we going back and forth over the gums on the inside of the teeth? Why are we doing this?
To get rid of all the debris.
That we just loosened
That
up.
we just loosened.
Right. They have excellent electric toothbrushes, but a lot of people don't like to use those because whatever. But a good place to use an electric toothbrush is actually in the shower, because you're all wet anyway. Okay, so that's that part. Now, if you do this type of thorough cleaning twice a day instead of the very crummy job that most people do in morning and night, that will cut your tooth decay down by a lot. But here's what's really going to cut your tooth decay down by much more than that.
Yes.
Now, did any of your dentists ever tell you to use these?
No.
Okay, so she is cleaning each one of the holes between the teeth, because that's where a lot of food and debris can get lodged in there. And so if you just kind of clean it and then also go up, after you get it in, then go up, yeah, that not only cleans the debris out, but it also keeps the plaque from forming. The thing is, I think it's harder for kids to use these little dental brushes in between the teeth because, first of all, the spaces in their teeth are not very big, and it might be hard to get them in there. So in that case, they have these little flossy things. Now, Elyse, have you ever seen these?
Yes, I always use them.
You actually use them? Okay.
Yes.
Elyse is demonstrating the way most people use dental floss. They think that all they're doing is cleaning whatever debris got stuck in between the teeth. The problem is that that's only half the purpose for dental floss. The other important thing that we're doing with dental floss is we put the floss in between the two teeth. Now we made it through. Now we want to scrape the sides, the forward side and the backward side. Up and down, up and down. Not only once down and then out, but we want to scrape the sides, clean the sides. What are we cleaning off the sides when we do that, Elyse?
Plaque.
What is your understanding of what plaque is?
Plaque is, I think, just broken down food that gathers on your teeth.
And is it hard or soft?
It's soft.
No, it's hard. And the longer that you wait, the more it builds up. The word is calculus, which is plaque that has become hard. The problem with the plaque is that it draws bacteria. It is a place where bacteria can set up shop. It causes inflammation of the gums, and that's why when your gums start bleeding when you brush your teeth, that's usually an indication that the infected plaque has made the gums be infected, and it's time to have a deep cleaning and clean the plaque out. So to review, Elyse, now show what you just learned.
Purpose number one is just to get loose food out.
Mm-hmm.
The second purpose is to clean plaque off the sides of the inside of your teeth.
Right, and so you keep that idea in mind as you floss all the way around your mouth. I'm not only getting food particles out from in between the teeth, I'm also trying to polish the sides of the teeth to keep the plaque from forming. Yes, very good. To keep the plaque from forming. Excellent. Okay, now do you have any questions so far?
No.
Okay, so now, what kind of toothpaste do you use?
So I use a special brand deodorants.
Okay, and what does it taste like?
It tastes like mint.
Okay, so that's fine. I really don't think it matters that much what kind of toothpaste you use. It matters much more how often you brush your teeth. So, have you ever met like a woman who's in her 20s and she has beautiful teeth? I mean, they look like something out of a movie.
Yes.
Have you ever known anybody like that?
I haven't known anybody, but I've seen a lot of people.
Okay. Usually those people will describe themselves as dental nuts. They're nuts for dentistry. They clean their teeth all the time. They floss their teeth several times a day. They brush after every meal, and they really value and take care of their teeth. I wish that I had been one of those people all my life, and so I'm hopefully by this video younger people will realize the value of the teeth, how fragile they really are, how fragile the gums really are. Elyse, can you give us a quick review and really loud of what you've learned in today's video?
I have learned that the proper way to brush your teeth is the proper place to brush your teeth is right in between the gums and the tooth, and you must do a minimum of 10 strokes per tooth.
Louder.
20 strokes per tooth. 10 on the outside and 10 on the inside per teeth.
And then what?
And then, well, preferably beforehand, you would use your preferred floss or
Yes.
cleaner,
That's called a dental brush.
brush.
Can you actually fit this in between your teeth?
No.
Okay, that's what I thought. The spaces between their teeth are very small,
Yeah,
so
that's a problem I have. A lot of my teeth can't grow in because I don't have enough space.
well, it's actually good. It means your gums are really high. That's actually a good sign. Okay, but you were talking about floss.
Anyway, so with this kind of floss, well, with any type of floss, the first purpose is to get the food up in between your teeth, like the big chunks of food, and then also to scrape off any plaque you have on the inside of your teeth between the spaces on your teeth.
Yes. So the two things you're doing with floss are, number one, you're getting the particles out from in between the teeth, and number two is you are
You are cleaning the plaque.
cleaning the plaque off the forward wall and the back wall
Mm-hmm.
of each tooth. And the last thing is called polishing the teeth. And this is up and down, and make sure you get all the way into the gums when you do this, right? But do this very gently. A lot of people are in a hurry and they do this really hard, and some people think they didn't do it right unless they see blood in the sink. So that's not good. If you see blood in the sink, you're definitely doing it too hard. If you don't remember anything else from this video, please remember this. The gums are just as important as your teeth. We must respect our gums just as much as we respect our teeth. So, thank you very much for listening to today's presentation on dental hygiene. And Elyse, did you have any questions or anything else to say?
Yes. So for the last step of polishing your teeth, a lot of people believe in special toothpaste, such as whitening toothpaste, or sometimes people get charcoal powder, dip their toothbrush in, and then polish their teeth.
Okay.
Is that really an effective way, or what's your opinion on that?
My opinion of that is that it's marketing, and it's not really as important as actually polishing the teeth. Now, but what you just showed us was very instructive, because that's what a lot of people do. Your final step of polishing the teeth, did you see what Elyse just did? She went this way. You don't want to do this with the polishing step, because that can traumatize the gums. The only way to polish the teeth, your last step, is to go up and down, and to go all the way up over the gums and down. And I'm doing this extremely lightly. Do you see how lightly I'm doing that, Elyse? In this step, do it really lightly, and that will protect the gums and protect them from bleeding. Now let me see you do that very lightly, the polishing step. Okay, that was correct, but it was really fast. Now just do the front teeth, but do it. Stay on one area longer. That's what I'm saying. Yeah. Elyse, are you one of these people who gets a mouthful of water and toothpaste and walks around the kitchen talking to people with your mouth full of brushing your teeth?
I don't talk to people, that's gross.
But do you actually walk around the house and do that?
A little bit when I'm like...
By yourself?
Yeah.
Actually, that's not too bad, because it means you're taking your time brushing your teeth. Because that's the biggest problem that I think most people have with brushing their teeth. They don't like to do it, they think it's a chore, and they do it as fast as possible. Do you think that's true?
No.
No? Okay, maybe that's not what you do, but that's what a lot of people do. Well, that's so you take your time brushing your teeth normally, right?
Well, yeah, normally, if I'm in a rush, then I'm not as careful. The best time to brush my teeth for me is in the shower at night, because that makes me take my time.
Mm-hmm. Do you keep toothpaste in the shower?
Yes.
That's a great idea right there. The shower is the best place to brush your teeth. Really.
And also a thing that makes me brush my teeth more is when I put my conditioner in first, and then I brush my teeth for a very long time to let the conditioner soak in,
Mm-hmm.
and then I can get two things done at once.
Right. And you know what? A really good thing after you're done brushing your teeth. Okay, you're done brushing your teeth, and then you rinse all the conditioner out of your hair. When all the conditioner is out of your hair, then open your mouth and let the shower kind of wash your teeth. That's a good idea too. So we hope everybody out there got some good ideas about dental hygiene. Thank you for your kind attention.
Goodbye.